Hey guys, and welcome to How to Gastro. In today's video, we'll be talking about familial adenomatous polyposis, which is also commonly known as FAP syndrome. So let's get started. So before we get into the details of familial adenomatous polyposis, let's look at what FAP syndrome actually is. The F in FAP stands for familial, meaning it runs in families. The A stands for adenomatous, which is the type of polyps detected in the colon and the small intestines that can turn into cancer. And the P stands for polyposis, which is the condition of having lots of colon polyps. So if we put all these aspects together, we get that FAP syndrome is sort of an hereditary condition in which these large amounts of adenomatous polyps are found within the GI tract, mostly in the colon. And the special thing about these polyps that are found in the GI tract is that they have the ability to turn into cancer. So this is pretty much the simplest definition of what FAP is. So more about FAP. Familial adenomatous polyposis is an inherited condition in which numerous adenomatous polyps form mainly in the epithelium of the large intestine. While these polyps start out benign, malignant transformation into colon cancer occurs when they are left untreated. The gene for most cases of FAP is found on the long arm of chromosome 5 and is called the APC gene. So just before we get into the details of the genetics behind the disease, just want to point out what FAP looks like. So this is the image of our colon, and you can see these hundreds of small polyps that are found here. And this can be seen during a colonoscopy, and this little bubble here shows you the colonoscopic view of what these polyps look like. So if you look at this bubble, you can see these little polyps that are found here within the mucosa of the colon, and this is pretty much what FAP is. Lots of these polyps dispersed throughout this colon. So now let's talk about the genetics behind FAP syndrome. The root cause of FAP is understood to be a genetic mutation, which is a flaw in the body's tumor suppressor genes that prevent the development of tumors. This flaw allows numerous cells of the colon wall to develop into potentially cancerous polyps. 3 different variants of this syndrome are known to exist. The first one being called simply classic FAP syndrome, the second one being called attenuated FAP syndrome, which was originally called hereditary flat adenoma syndrome, and these two are actually caused by the APC gene defects on chromosome 5. The third and final variant is called autosomal recessive FAP, or MYH-associated polyposis, and is caused by defects in the MUTYH gene on chromosome 1. Of the 3, the classic FAP is the most severe and most common, although for all 3, the resulting colonic polyps and cancers are confined to the colon wall, and their removal can greatly reduce the spread of cancer. So if you look at my image on the left, we have these 2 chromosomes, and you can see the APC gene here, which is found on chromosome 5, and this mutation is found on the long arm or the Q arm of this chromosome. And because of this mutation here, this mutation actually causes a flaw in the body's tumor suppressor genes. So this gene is actually very important in preventing the development of cancer in the body. And when we have a defect or a mutation at this point, it's quite an alarming thing indeed, because now we don't have this gene which allows the body to suppress the development of tumor cells. And once we lose this gene, our body is more prone to the development of different cancers. And the special thing about this APC gene is that most of these patients will develop colon cancer. Actually, in untreated cases of FAP, there's a 100% chance that the patient will develop colon cancer. So first, these patients will develop these hundreds and thousands of polyps in their colon, and then they will also be prone to the development of other cancers. Because we have a problem with a tumor suppressor gene, the body is not only going to be prone to more cases of colon cancer, but it's going to be more open to all kinds of cancers. So the first 2 variants of FAP syndrome, which is classic FAP syndrome and attenuated FAP syndrome, are caused by a mutation in the APC gene at the 5q21 region. And the third and final variant of FAP is caused by a mutation of the MUTYH gene, and this is found on chromosome 1 on the short arm in area 34. So it's a 1p34 mutation. And if you notice here, it's written that it is an autosomal recessive condition. And that means patients who have this condition due to the MUTYH gene, they have to have both chromosomes that have this defect in order to have the disease. So they must have a chromosome from their mother and they must have a chromosome with their fathers who are both carriers of the disease in order for them to actually have the disease. And this is briefly the genetics behind FAP syndrome. So now let's look at those three variants a little more closely. The first variant is classic FAP syndrome. And in this disease, the root cause is understood to be a genetic mutation, which is a flaw in the body's tumor suppressor genes that prevent the development of tumors. The flaw allows numerous cells in the intestinal wall to develop into potentially cancerous polyps when they would usually reach the end of their life. Inevitably, one or more eventually progress and give rise to cancer. These patients possess a 7% risk of cancer by age 21, rising to 87% by age 45 and 93% by age 50. Something to note here, however, is that the flawed genes do not trigger the cancer, but rather they reduce the body's ability to protect against the risk of aged cells becoming cancerous. So just to recap again, the first variant or classic FAP is caused by the mutation on chromosome 5 on the long arm, which is the Q arm, and is a mutation of the APC gene. And in this type of FAP again, we have the development of these thousands and thousands of polyps, which are adenomatous, and they have the ability or the progression towards becoming cancerous. And as you can see here, one is growing quite fast and has a high prognosis towards malignancy. So the second form of FAP is known as the attenuated familial adenomatous polyposis and has an APC gene that is functional but slightly impaired. So again, these patients also have that faulty APC gene, but the difference between classic FAP and this form of attenuated FAP is that while these patients have the gene that is impaired, it is only slightly impaired. Therefore, in these patients, the APC gene is therefore somewhat able to operate as usual. Attenuated FAP still presents a high 70% lifetime risk of cancer, as estimated, but typically presents with fewer polyps, typically around 30, rather than the hundreds or thousands that is usually found in classic FAP, and arises at an age when FAP is usually no longer considered likely, which is typically between 40 and 70 years old, with an average of 55. So if you look at my image below, you will see that the amount of polyps that is found in this colon is typically very few in comparison to the classic FAP polyps. So let's go back to that picture. So you see this large quantity of polyps that have developed here, and this is the classic FAP, and then compare it to this attenuated form of FAP. And you can see here there's a huge difference in the amount of polyps that develop in this colon. So something to note here again is that the attenuated familial adenomatous polyposis is also caused by a mutation in the APC gene, but here the gene is only slightly impaired and still has a high chance of acting out in the normal way, meaning that it is able to suppress tumor cells and development, which is actually its function in the human body. But however, these patients still have a high risk of cancer, but early detection and the removal of these polyps will give these patients a better prognosis. So now let's talk about the third variant, and the third variant again was called the Autosomal recessive Familial Adenomatous Polyposis, or the MYH-associated polyposis. This is also milder, and as its name suggests, requires both parents to be carriers of the disease in order to manifest the condition. So again, we have the father and the mother, which are both carriers, and you can see from all their children, we need the child to have both MUTYH genes affected in order for them to have the disease. So we have a defect in this MUTYH gene and this MUTYH gene from both parents, and this is why the child has this last and third variant of autosomal recessive familial adenomatous polyposis. And you can see here there's a 75% of these children being healthy, with a 25% chance of unaffected and not a carrier, a 50% chance of just being carriers, and a 25% chance of being inevitably affected. So now let's talk about some signs and symptoms of FAP syndrome. Classic FAP is characterized by hundreds to thousands of colorectal adenomatous polyps, with polyps appearing on an average of age 16. Without colectomy, affected individuals usually develop colorectal cancer by the third or fourth decade of life. Most patients with FAP are asymptomatic until they develop the cancer. Some symptoms of FAP syndrome may include bleeding from the rectum, which is called hematochezia, a change in bowel habits with patients experiencing constipation or diarrhea, experiencing abdominal pain, having low blood counts, which is anemia due to chronic blood loss from these polyps, and having unexplained weight loss. So something interesting about FAP is that not all the symptoms of FAP are cancer-related. Some additional features of FAP may include osteomas, which are non-cancerous bony growths usually found on the jaw. And this is an X-ray here, which shows this osteoma, which is found on the mandible of this patient. The patient may also have extra, missing, or unerupted teeth, congenital, meaning present at birth, hypertrophy of the retinal pigment epithelium, and this is an eye condition that does not affect vision, but is a condition that an eye doctor may see during an examination with a special instrument called an ophthalmoscope. Benign, meaning non-cancerous changes in the skin, such as an epidermoid cyst or fibroma. This is actually an image of an epidermoid cyst. And also the presence of adrenal masses. So remember again that FAP is caused by this gene mutation, and that specific gene that is mutated is a tumor suppressor gene. So once the body is missing this gene, it means that it's unable to suppress the development of tumors. And tumors may be benign or they may be malignant. So if we look at this list of signs and symptoms, you'll see that a lot of them are tumor related. We have osteomas or these bony growths. We have epidermoid cysts and fibromas. We have adrenal masses. So they're all sort of related to growths that are happening in the body that are not actually supposed to happen. And this is because we have a defect or a problem at that point at the tumor suppressor gene. And this concludes part 1 of the Familial Adenomatous Polyposis. In part 2, we'll be talking about some complications, the diagnosis, and the treatment of this syndrome. So see you there.